Hello, and thank you for spending time with us today. My name is Ashley Kasperzak, and I'm a Development Officer with the UCHealth Longs Peak Hospital Foundation. We've planned this live event for our supporters to learn more about our hospital and how we serve the St. Vrain and Carbon Valley areas. We're recording today so others can watch it later. As shared in the invitation, our presenters are Lonnie Cramer, Longs Peak Hospital President, and Dr. Mark Shane, Longs Peak Hospital Chief Medical Officer. We have the good fortune to also have Noreen Bernard, Chief Nursing Officer, and Jason Amrick, VP of Operations. They will discuss our hospital's current projects, accomplishments since we opened 3 years ago, and COVID-19, which is on all of our minds. Their presentation will be approximately 40 minutes, and then they will address questions that were posed in advance. Those participating in the live event today may post questions through chat, and then we will share those questions with the presenters. We take COVID-19 very seriously, and extra safety precautions are our new norm. When at this podium, speakers will not have their masks on, but off camera, all of us in this room are wearing our masks and we are social distancing. We hope you stay safe and healthy wherever you are. Now I will invite Lonnie Cramer to lead us off. Thank you.
Thank you, Ashley. I want to first off thank all of you for participating today in this town hall event, giving us the opportunity to speak about Longs Peak Hospital, our surrounding care throughout the communities that we serve, as well as some of the projects and some of the things that we are working on here at Longs Peak Hospital. So with that, I'd like to start the slideshow and share a few of the key points with you today. So today we're going to talk about a few things. First off, who we are, both as an organization and as a community hospital. Next, we will launch into our Longs Peak Hospital Foundation and what the foundation has accomplished over the last 3 years here at Longs Peak Hospital. And then we'll be joined by Dr. Mark Shane, who will speak to us about our COVID-19 pandemic, how we responded both as an organization and as a facility. Along with that, he'll speak to some of the new issues and some of the support that we have received. And then next, we will move into the future, what we are doing to expand care and expand our services throughout the Longmont region. And then lastly, we will end today with a few questions and discussions from our audience. So once again, Ashley has pointed out to the right of the screen, you can see how to pose a question if you have one. So moving into who we are as an organization. So UCHealth is a Colorado-owned and operated nonprofit health system. It's an independent 501c3 from the University of Colorado. With that, here are some stats that I'd like to share with you today. In FY19, our last fiscal year, we have served 1.7 million patients throughout the organizations. We have over 24,000 employees and over 5,000 employed and affiliated providers throughout the state of Colorado. With that, UCHealth invests in our community through uncompensated care, research, education, and partnerships through programs and community events. With that, some more interesting stats is that we have $933 million in community benefits that we have presented, $367 million in uncompensated care, and we've also supplied $245 million in support to the University of Colorado School of Medicine. These are some huge events, huge opportunities, and things that we have accomplished over this past year. I want to remind everybody, these numbers are through our fiscal year 19. So are many of the numbers that we'll be presenting today. Our fiscal year runs from July 1st through June 30th. So just wanted to point that out. I think Dr. Shane will be sharing some updated numbers as it relates to COVID, but I want to keep that in mind as we present today. Want to point out our mission, vision, and values off to the right of the screen. We live these missions, vision, and values each and every day as we care for those around us. So moving on, let's talk about Longmont and Longs Peak Hospital specifically. We have been fortunate in last year to serve almost 222,000 outpatient visits. We have performed over 2,000 surgeries, both inpatient and outpatient combined. And we have brought 734 new babies into this community. It's very exciting. I won't go through all the data today, but you can see up there that we are growing and continue to grow while performing high quality care. I want to point out that we are in the top 7th decile in the country as it relates to quality performance nationally. So with that, we have provided $51 million in total community benefit and $21 million in uncompensated care. Who are we as a facility and what is the overview of our campus and our community? So Longs Peak Hospital is approximately 210,000 square foot. Currently, we are a licensed 51-bed facility, and we have an additional 50 rooms that have been shelled to allow us to grow and expand without touching the outside of our buildings. So that includes 36 med-surg units, beds, 6 ICU beds, 3 labor and delivery recovery suites, and 9 postpartum rooms. I do want to point out that some of that construction is going on right now. So if you can hear it on the screen, I apologize, but that is the ICU expansion that our VP of Operations will speak to shortly. Our ER is a level 3 trauma center designated in the state of Colorado with neurosurgical capabilities. We are a certified primary stroke center, and we are one of only 3 hospitals in the state that are accredited by the American College of Emergency Physicians as a geriatric ED. These are some huge accomplishments that I want to also thank our team who has accomplished many of these in this past year. Our birth center has a level 2 specialty care nursery unit. So as we look at bringing those 734 lives into this community, we have that specialty care from our providers and our nursing staff. We are a fully advanced imaging and cardiac cath center. We have a 24/7 cath team and IR suite that performs those interventional procedures right here on our campus. So with that, we also have a Longs Peak Surgery Center that is attached to our campus here, which is an additional 15,000 square feet with 3 operating rooms and an endo suite. We also have space there to expand. So let's talk about our history a little bit. I get asked often about how new the hospital is and how beautiful it is, and it's only 3 years old. And we are very fortunate to have a brand new 3-year-old facility. However, I do want to point out and point to the long legacy of caring for this community that UCHealth has through our Longmont Clinic. The Longmont Clinic here in Longmont opened its doors in 1906, 14 years before the Cleveland Clinic. They joined UCHealth in 2014, and then Carbon Valley Medical Center in Firestone opened its doors in 2004. They continue to serve the communities of Firestone, Frederick, Tocono, and the surrounding areas in the southwest Will County. In 2019, we were fortunate enough to open 2 urgent care locations, one in North Main Street in Longmont, and the other in Firestone next to our Carbon Valley Clinic that provides both urgent care services, but also primary care and some specialty support. Our North Main Street also posed as one of our sites for a drive-up clinic for COVID testing. Our partnership with UCHealth means access to an even broader network of care and specialists and subspecialists across the Front Range. It also allows us to tap into those clinical trials and those researches that are being conducted today. With that, we have 110 providers and advanced practitioners within our Longmont Clinic. This represents 22 unique specialties in over 5 locations around the county and surrounding area. So with that, I'm going to turn it over to our Chief Nursing Officer, Noreen Bernard, to share a little bit more information about our talent and our care here. Noreen.
Thank you, Lonnie. Good afternoon, everybody. It's great to have you online with us. We wish it was in person, but we will take this as an alternative. So those of you who know me know that I would be the very first person to tell you that patient care delivery is a team sport. And that being said, nurses make up usually a very large portion of the employee population. Earlier you saw that we have about 880 employees, so anybody who's doing math right now knows that this is about 35 to 40% of our employee base is comprised of nurses. What I really want to highlight for you, and it was such a gift to inherit this employee group about a year ago when I joined the organization, is that 84% of our nurses have a baccalaureate degree, a master's degree, and or a doctoral degree. A few years ago, the Institute of Medicine put forth a national goal that all hospitals would have 80% of their nurses have a baccalaureate degree or higher by the year 2020. So guess what? We've already exceeded that, which is so awesome. 28.5% or so of our nurses hold a specialty certification, which is not required for their job, but is above and beyond, and something that they've gone out and done in order to be able to become the very best experts in their area of care delivery. Lots of research demonstrates the connection between specialty certification and improved patient outcomes. So that's a little bit about our nursing population. One of the other things we wanted to share with you is that when Longs Peak Hospital was first opened, it genuinely was probably legitimately the very first innovation hospital in the state of Colorado. And when I speak with my national colleagues, they are so jealous of us because we have all this wonderful technology that helps us deliver care in the most contemporary way possible. The other nice thing about all of this technology, which on your screen is just a sampling, we actually have more, is that we've combined it with surveillance from our virtual health center and blended that then in with some algorithmic functions in our medical record. And what happens then as a result is we get notified much earlier when patients are deteriorating, maybe when they're decompensating, maybe when they need some type of early intervention. All of those things that you see here have helped us be able to deliver the very best care to all of the people in our community at a speed that we normally could not have done in any other way. So that's a really great component to what we do here. Here are the quality outcomes that we get as a result of the phenomenal care providers that we have in our care team, our combined technology, combined artificial intelligence. You'll see the majority of our quality indicators are over there on that left-hand side of your screen. We're in the top 10% performance across the nation in comparative hospitals. So we work really hard to stay in that top decile. You'll see that our patient satisfaction scores, which is what the HCAHPS terminology is in the top 25th percentile, but I will tell you we're about 1 to 2 percentage points away from being in the top 10 percentile. So guess what we focus in on all the time. And then as you move over to the right, the only other metric I want to point out is CAUTI. So it stands for catheter-associated urinary tract infection, something that oftentimes happens to patients when they are hospitalized. And while it looks like we have room for improvement, I want to share a fun fact about this metric. Longs Peak Hospital has been open for 3 years. We've only had one patient in that 3 years who has experienced this catheter-associated urinary tract infection. And so we're actually very proud of that number. It ended up over there because of the way that those things are calculated in the database. So we have great quality metrics. I tell people all the time that I would let anybody here take care of me. It's a phenomenal group with phenomenal outcomes. The other thing I get to tell you a little bit about is what the Longs Peak Foundation has been able to accomplish in the last 3 years. So you'll see that there's been over $569,000 raised by our community for the Longs Peak Foundation. Interestingly, about half or 46% of those funds have been raised by the employees here of our hospital. I think that illustrates the degree of commitment and loyalty that they have to their own organization and to their community. Over to the right, you'll see that we have about $150,000 in scholarship funds. And then some of the other big bucket areas is the Patient Assistance Fund, the Area of Greatest Need, Women and Children's Fund, etc. I want to point out that that scholarship fund has really helped us achieve that earlier accomplishment that you saw of 84% of our nurses having a baccalaureate degree or higher. Plus, it helps many of our other employees as well. A little bit more about the last 3 years with the foundation and how many lives have been touched. You'll see on your screen some specific categories of how the activities of the foundation have benefited different groups of people and different types of activities. But I want to point something out to you. When I was looking at this and thinking about it, I said, hold on a minute. If I added up all these numbers, it comes to 3,739 people over a 3-year time period that were positively impacted by the foundation. Then I said, well, what is that average per year? Well, that average is about 1,246 people per year. And if we said, well, what does that mean on a monthly basis? It's about 104 people per month receive the benefits of the Longs Peak Foundation. And then if you wanted to go even to by day, it's 3 to 4 people a day that actually benefit from the foundation. And that's just a tremendous accomplishment. So thank you for all that you've done to help us get there. And then finally, I want to talk to you a little bit about a story. And it may seem like an extraordinary story, but I have to tell you, in my 1 year of being here with the organization, these stories go on all the time. So we had a patient who came in, he was by himself in a motor vehicle accident. We needed to provide some pretty high level trauma care for him. He had multiple injuries. He was here for a long period of time, transferred to the rehab center. And during his health and healing process at that rehab center, his landlord decided to evict him. Well, our therapy staff found out about that, and they gathered some of their friends and family and colleagues, and they said, we'll go over to his mobile home and we'll take everything out. And with the help of the foundation, we were able to put that into a storage area for him so that it would be there when he was done with his healing process. And like I said before, this is just one of many stories. We have stories like this all the time. It's what makes Longs Peak so special. And with that, I would love to hand it over to Dr. Mark Shane to tell you a little bit about how we all came together to take care of our community during COVID-19. All you, Mark.
Thank you, Noreen. Appreciate it. Well, hello, everybody, and I'm very honored to be meeting with you all virtually today. So our response to COVID-19, and I know this is a topic that we've all been thinking about probably every day for the last 6 months, as far as how it has impacted us, both personally and professionally. So here at Longs Peak, we were available for the community as soon as the pandemic seemed to strike Colorado, and you can see early on in the process, if you went to the far left of the curve, that the rates of COVID really jumped up rapidly here in Boulder County and in the Longmont Carbon Valley communities. We actually at one point had 9 patients in our 6-bed ICU during the height of the pandemic. So we actually had to double up rooms to take care of all the patients who were seeking care here and who needed to be hospitalized. This graph actually goes through the month of June, and at that time you can see there were 60 patients who were hospitalized for COVID at Longs Peak, and 52 were able to recover and go home. At that time, we actually took care of 1/3 of all Boulder County patients who required hospitalization from COVID. So the community really did seek us out and to take care of them during this crisis. Just to kind of update you, since then, we have had a total of 79 patients hospitalized here for COVID, and 71 of them have been able to go home or onto another facility for long-term care, and then hopefully home from there. So we're very proud of the work that all of our staff has done during this crisis and pandemic. So one of the things that became really apparent during the pandemic for COVID is just the impact it had, not only on our patients, but on our staff, our employees. Everybody was just really working above and beyond what they may have done previously, because we wanted to take excellent care of our patients. It was an extremely stressful time for us all. There was a lot of unknowns back then, and so as a system at UCHealth as well as Longs Peak, we were very much aware that we had to take care of our employees so they could really take care of the patients. During that time, we actually established an employee hardship fund to help our employees meet any expenses that they may have, understanding that for many of them, they may have had a spouse who was not able to work during that time, as well as their children were not able to go to school and may have had to find other sorts of childcare. We also set up a nurse triage line for not only our patients, but for our employees if they had concerns that they might have been exposed to COVID patients if they weren't wearing proper protective gear or just kind of wherever else they may have gone to. We also put in measures so that way we would have enough personal protective gear for our employees so they could care for all the patients safely. And this was really a system-wide effort that we did. It took a Herculean effort for us to make certain that our employees had the equipment they needed to be safe not only for themselves, but as well as safe for care of our patients to prevent the spread of infection to anybody who may have been here at Longs Peak. And then finally, we set up an entire behavioral health program for our employees, so that way they could have appropriate resources to manage their stress and anxiety, which I think we all felt during that time. As far as as we've moved through the pandemic and we now are very much comfortable and very used to taking care of patients who have COVID-19, we want to be very much prepared for a second surge in cases if that does occur later this fall. One of the things that we have done as a system really is to build up our inventory of personal protective equipment for all of our staff and employees, so that way they can continue to provide the high level of care for our patients. We also have increased, some of our other equipment, such as ventilators, making sure that we have excellent tracking, knowing where all of our equipment is day to day. So in case we have to shift resources, we can do so as quickly and efficiently as possible. We've been working steadily with the state public health departments, as well as Boulder County health departments, once again, making sure we have enough lab supplies and can do the appropriate testing for COVID-19 as it's necessary to serve the community. And then we, once again, as we've been working closely with our government public health agencies, really kind of hand in hand, we are sharing best practices with them, sharing information so they understand what is happening really here at Longs Peak Hospital with just our own capacity so we can take care of the community. One of the things that was really impactful for us here at Longs Peak was the amount of support that we felt from our local community. You have no idea how important that was for everybody here working at the hospital to know that we were being supported by the community, that we were in their prayers and wishes. The contributions of our local businesses, both large and small, who provided meals for our staff during this time, that really kept people going. I can't thank you all enough for that local support. It made a difference, and I think just that local community support really enabled us to take care of patients and get them home safely. The contributions from larger restaurants also, I think I need to acknowledge, is they provided meals and coffee and cake. That was well appreciated. The masks that we received from families, people making masks, just reaching out, one saying, hey, we have some protective gear that I don't need from different businesses. Being able to know that we had that supply as a backup in case we needed it, if we did not have enough of the medical grade equipment, knowing that we could still protect everybody, that was critical to continuing our mission to serve the community, as well as just the relationship and the support that we had with our local Front Range Community College and both other businesses. That really, I just can't thank you all enough for caring so much and reaching out to us during that stressful time. I would now like to turn over to Jason Amrick, who's our Vice President of Operations, to talk more about the future.
Great, thank you, Mark. Good afternoon, everyone. This is Jason Amrick, VP Operations for Longs Peak Hospital. Happy to be here. And the immediate future actually looks like reactivation. So as Mark talked about our COVID response, our immediate future has been dominated by making sure we have the reassurances in place so that patients and family members can come seek us out for care. So since our initial response, we've reactivated all of our elective cases and services, including surgery and outpatient imaging. And we've seen that in the community by an increase in physician clinic visits, telehealth visits, urgent care visits, and folks coming into our emergency room and obviously seeking out care from our specialists. We're excited to see that trend as we move through this pandemic. As the future progresses, though, we're also focused at increasing our ambulatory services in the community. Here you'll see pictured our Longs Peak Medical Center. Longs Peak Medical Center is a 4-story, 100,000 square foot building that will bring new services via UCHealth to the community, including outpatient imaging, rehab services, orthopedics, oncology, and other physician specialist services. This project is well underway. In fact, we expect to have steel going up in October, and we look forward to our first patient day, likely in May or June of 2022. This is another picture from looking towards the west. You can see the foundation pylons being poured here, and this active site is just getting busier and busier and changing every day. Here in the campus is an aerial view, and you can see our campus currently outlined in red. We're excited to see the community choose this as an area of opportunity and growth. Pictured in the northwest corner on that yellow line is a brand new future development that will include 400 units, including condos, apartments, townhomes, and single family homes, which will bring residents in and around the Longs Peak Hospital campus. Also to the north of our building, you'll see 2 other plots of land that are destined for future growth, either potentially a skilled nursing facility or memory care center, or additional retail space, or possibly another medical office building. Either way, we know that as we exist here, the community will continue to need healthcare services, and we're prepared to serve them. South of our building, which you can't see pictured here, are 2 other industrial plots, and we look forward to seeing continued growth of Longmont as companies choose to be in and around this area. Within the hospital itself, and actually just below the feet and the ground that I'm standing on, is our existing ICU space, but more importantly, a 6-bed ICU expansion. We'll be building out 6 more additional ICU beds into about 4,600 square feet. That doubles our current critical care capabilities and will actually help us respond to what the community is bringing to us in any future COVID increases in patient census. In addition, in the hospital, we're adding a 2nd trauma room. This is going to open up hopefully by January of this year. And this again signals our commitment to the community and also our first responders that we can take care of the critical care patients that they bring to us, and that we have the ICU space to take care of those patients as well. As Lonnie mentioned too, the hospital is also uniquely positioned for growth. We currently have 51 beds, as he mentioned, but the hospital itself can expand to over 100. And right now we're currently looking at where in the hospital is the best place to add new beds. So with that said, I'll turn it back over to our president, Lonnie Cramer.
Thank you, Jason. Before we jump into our questions and discussion, I want to first extend my gratitude and thanks to all of you that are participating in this town hall, for those of you that have contributed to our foundation. As you've heard, there are a lot of heroes among us, but I want you to know that your donations and the work that you have done is equally as important. The certifications and the patient assistance and staff assistance that you have allowed to happen here in Longmont has changed the lives of our associates, our staff, our patients. So with that, as we continue to look at philanthropy as an opportunity to grow and expand our services, I want you to know that we will be sending out a link. If you would like to hear more or learn more about the expansions and how you can get involved and make a difference here at Longs Peak Hospital, we'll be happy to discuss that with you. So with that, I'm going to open it up now to questions and discussion. Ashley, do we have anyone posing a question?
Yes, Lonnie, thank you. We've received several. So first of all, someone is asking if it's safe to receive medical care.
I'm glad that that question was asked. Absolutely. We are now seeing numbers of 0 to 3 admissions a day or positive cases in COVID. So 98% of what we're dealing with today is routine healthcare that we have been providing here since 1906. So yes, the hospitals are very safe. It's a safe place to seek care. And we are actually more concerned with the delayed in some of the other symptoms, such as cardiovascular disease, stroke, and other things. So please, don't hesitate to reach out to your providers and your healthcare systems to seek that care. Hospitals actually have a lower conversion rate than our community does as it relates to people showing positive. So therefore, it is safe and it's the right thing to do. So please seek medical attention when and where necessary.
Thank you. And are there any therapeutics that show promise in dealing with COVID-19?
Ashley, thanks for that question. I think with that question, I'll turn it over to Dr. Mark Shane, who I think is more suited to answer that. Thank you. Dr. Shane?
Thank you, Lonnie. Well, there's so much research going on with COVID as far as managing these patients, and we've learned so much since early March, and we're doing a much better job really across the country as well as the world in keeping patients alive and getting them home. I think the most important therapeutics that we currently are utilizing are giving patients a steroid called dexamethasone, which really limits the irritation and inflammation in their lungs, and doing that as soon as possible. That has had a huge impact just in recovery for our patients, as well as really trying to maximize their use of oxygen before we put them on a ventilator. That too has had a huge impact in the care of our patients. But there continues to be research. I think, as we all know, vaccines are going to be hopefully the most important thing we can do is try to prevent people from getting that severe illness with COVID-19.
And that is a follow-up question.
Okay.
When do you expect that a vaccine may be available?
So that's a great question, and I think we all want one as soon as possible. But I think, as we look into what it takes to really produce and make a vaccine, my hope would be is that we see a vaccine that we can start to administer to everybody beginning sometime in the first quarter of 2021.
Another person has asked, what are the best resources to track current local COVID data and health recommendations?
So I think locally, and this is a resource that I personally have looked at on a frequent basis, is I will go to the Boulder County Department of Public Health website, as well as the Colorado Department of Public Health website. Both those really provide up-to-date information, and I find them to be very useful tools for us to understand what's happening in our community.
And someone's asking about rapid testing. Is it available here or will it be available soon?
So I think I'm very proud of what we as a system have done for testing our patients here in Colorado, as well as in Longmont, Boulder County, and Carbon Valley. We did have the first testing site that was opened up in the county, and that is on our North Main Street campus here in Longmont. And so that test, actually, our turnaround time is very good, typically within 24 hours. Once again, there's a lot of new testing coming out, new research. We do hope to have a rapid test available sometime in the near future, but it needs to meet our stringent criteria for being accurate. So that way, when you know that you get the test result, that it is accurate to say for either positive or negative if you have the disease. Not every test is the same.
So there's some additional questions about testing. One, that site on North Main Street in Longmont, is it a drive-through? How does it work?
It is a drive-through site, but you do need to have an order from your physician. Or, if you are seen at the urgent care, you can also, they can also place the order. If you are already established with UCHealth, you can also, you can go into your My Health Connection account, and you can also order a test that way.
And is that a blood test or a spit test, or what kind of test, someone asked?
So right now, for the test, there are two tests that you can order. One is the nasal swab test, which is, we take a very kind of a Q-tip and we swab the very back of your nose with that. That is a test to see if you have the actual COVID virus now. And so that's the test that we use to see if you are actively infected and if you have the illness, as well as if you are at risk of spreading it to other people. And then the blood test that we currently have is an antibody test. And what that tells us is, have you been exposed to COVID virus at a high enough level where you have developed your own antibody or immune response. And so that is a blood test that we can also do through our testing sites or that are here locally.
So with the colleges or some places that are using that saliva test, is that have a high level of confidence?
So the saliva test has gotten much better than where it was 2 months ago. And from the information that I've kind of read is we are now up to sensitivity meaning that it will pick up about between 80 to 90% of the cases if you actually have it, is what I've read most recently on the saliva test. So that's really pretty good. But once again, that may mean that 1 out of 10 patients who have COVID may come up as what we call a false negative. So we wouldn't necessarily know that they have it. But it is, I think, a good test. It keeps on getting better. So we have not adopted that yet here at our testing sites. Just to give you an example, our nasal swab that we provide our patients, if you get that has a sensitivity rate of 99.8%, I believe. So really, there's only going to be maybe 0.2% of patients that we would miss if they're actually positive with COVID. So we are very stringent criteria on which tests we are rolling out here.
Thank you. Another one. What precautions are being put in place to protect seasonal flu patients for exposure from the COVID-19 patients?
I might ask Noreen, our nurse chief nurse officer, to answer that question.
Slide it over. Thank you for that question. You know, that's I think going to be a hot topic actually over the next few months as we navigate both COVID-19 and influenza. So I think a couple things that are important to recognize. One, there's different tests for both of those. And what the game plan is as patients are entering into our clinics, into our emergency department, we can actually test for all of it. So the different lab tests will immediately rule in or rule out influenza, and then it will go on down kind of a little algorithm and rule in or rule out COVID-19. Depending on what comes back, then that would determine how we care for patients in terms of isolation procedures, the use of personal protective equipment, etc. As you all know, the flu has been around for hundreds of years. There's some conjecture that the use of masks will actually help reduce the number of flu cases this year. We're seeing that in Australia, and they're a few months ahead of us, and they've already experienced their flu season. So we're hoping that between testing and being able to triage out who has what, and then delivering appropriate care based on who needs what type of isolation procedures, equipment, and all that stuff, we'll be able to know exactly. We will know exactly what you would have if you came in, and would know how to take care of you. So
thank you.
Does that help?
Yes.
Okay.
Another one for you or
Okay.
Dr. Shane.
Okay.
Do you or Dr. Shane know how long the antibodies last from having COVID-19?
That's a great question.
Or is that still to be figured
I
out?
think that's a great question.
That is a great question. So
TBD, I think a little bit on that.
Yeah.
I'll invite Mark up.
So TBD. Excuse me. So because we've all heard about some patients who get COVID a second time. Those few cases that have been reported have occurred somewhere around 4 months after their first infection. So the best guess is for some people, your antibody level may kind of decrease where you can get affected again about 4 months later. But once again, that's not exact. We're still learning a lot every day about this virus. It's a very tricky virus.
Thank you. I don't believe we have any other questions today. I appreciate all of you participating and engagement from our community, and Lonnie will wrap it up for us.
Well, once again, I want to thank each and every one of you for allowing us to present to you today and to be a part of your day. As we move forward, both in this pandemic and healthcare in the state of Colorado and across the nation, I want to end by saying that social distancing works, hand hygiene works, and mask wearing works. So regardless of the rumors that are out there, it's your job to help save lives, and you can do that by protecting yourself and those around you. Remember, wearing the mask is to protect those more so than yourself. So let's all do our part to keep everyone healthy and whole, but also to keep our economy and our businesses up and running and open here in Longmont. So I'll end there, and thank you for this opportunity.